You may either have done a random blood pressure check at home, had your blood pressure checked by the practice nurse, or gone to see your doctor for something else and you've noted that you have raised blood pressure. Now, it can be very daunting to think that you now need to be on blood pressure medications, but in addition to taking medications, there are other things that you can do to help lower your blood pressure. And why is it so important to lower your blood pressure? Well, even reducing your blood pressure by 10 millimeters of mercury, so that's 10 on the blood pressure monitor that you see, can lower your risk of a heart attack or a stroke by a fifth. But what does this all really mean? I'm going to give you a really simplified explanation of the blood pressure before going on to talking about how we can lower it. When you take your blood pressure at home, we always advise you to use the cuff that goes around the arm and not the ones that go around the wrist, because the arm cuff gives you a more accurate reading. Once you've watched this video on how to take your blood pressure at home, you'll notice there are two readings. One is the higher reading and two is the lower reading. The higher reading tells us about the pressure within the blood vessels when the blood is leaving the heart, and the lower reading tells us the resting pressure in the blood vessels. Usually when the higher number is over 140 or the lower number is higher than 90, we say that you have raised blood pressure. But this isn't diagnosed from a one-off reading. You need to do the readings over a number of days, multiple times a day. However, depending on your age and other medical conditions you have, those blood pressure targets may differ. So if you're worried that you may have raised blood pressure, the best thing to do is have a chat with your GP and they can give you some more information. Now, I'm going to tell you about 5 ways that you can reduce your blood pressure in addition to taking medication that your doctor has prescribed you. And the number one and most important way that you can do this is by making sure that your weight is within a healthy range. And I know that without me saying this, if you are carrying some extra weight, you probably are aware that you need to do something about it. But often we fall into bad habits and lifestyle choices and they just sort of carry on, and it's really difficult to break that cycle. But if you have had a diagnosis of raised blood pressure, maybe this is the motivation that you're looking for, to make sure that you do more exercise and bring your weight down into a healthy range so that the heart is under a lot less stress and your blood pressure will come down as well. And I don't want you to think about dieting or doing vigorous exercise. I want you to think about sustainable things that you can do and change in your life, within your diet and exercise to make these changes. So think about a form of exercise that you enjoy. That might be Pilates, that might be light walking in the evenings, that might be just going on the treadmill for half an hour in the evening whilst you're watching TV. And with your diet, it may be that you still continue eating what you like eating, but you're just more mindful about things that have high calories in them. Whatever you choose to do, make sure that it suits your lifestyle and it's something that you can actually sustain. Tip number 2 is to reduce or cut out alcohol. Now, did you know that the alcohol allowance has actually changed? And it is recommended that if you are going to drink alcohol, you don't have more than 14 units a week. Now, this is true for both men and women. And when I talk about 14 units, I mean spreading it out across the week so that you have a maximum of 2 to 3 units a day, not everything in one day, like a binge, and then nothing for the rest of the week. 14 units is what we say is the maximum that you should be consuming. Ideally, if you have much less than that or nothing at all, then it will greatly benefit your blood pressure readings. Number 3 is that if you are smoking, then it's time to stop. And I know that you've probably heard this before, and it is really difficult when you have that nicotine addiction, but there is so much help available now. So when you're thinking about smoking cessation, don't just think about nicotine patches and e-cigarettes. There are loads of other methods and even medications that we can give you to help you stop smoking. Most GP surgeries actually run a smoking cessation clinic that all you need to do is inquire about it and get booked in. Smoking not only has a detrimental effect on your lungs and increases your risk of cancers, but it really has a negative impact on your cardiovascular health. That is the health of your heart and your blood vessels. The way it does this is it causes the blood vessels to thicken and stiffen, and it raises your blood pressure. Number 4 is to reduce your caffeine intake. Now, I know that we all like our cup of tea and our cup of coffee, so I'm not saying cut it out, but if you're drinking more than 4 cups of caffeinated drinks, and this involves things like Coca-Cola and energy drinks, then it's time to think about reducing those. If you feel like you will struggle with that, then you can always switch to decaffeinated options as well. And number 5 is to change your diet to be able to reduce your cholesterol levels in your blood. Cholesterol is a type of a fat that we find circulating within our body, and it can deposit into the lining of our blood vessels and cause them to thicken. And this causes a huge risk for us to have things such as strokes and heart attacks. But before it does this, it also causes raised blood pressure. So sticking to a healthy diet that is low of trans fats will be hugely beneficial. I know this might be very difficult to hear, and often with blood pressure, you don't really have any symptoms. So you're just thinking about numbers that keep coming up on this monitor, and it is difficult to motivate yourself to make these lifestyle changes because until the inevitable happens and you have one of those events that I spoke to you about, such as a heart attack, a stroke. But I'm hoping that if you've had this conversation with your doctor, if they've placed you on blood pressure medications and you are motivated to make some changes yourself, then this video will give you some hints and tips on how to do that. But lastly, if you are watching this video, it tells me that you have taken ownership of your health, and that is always an amazing thing to do. So best of luck with your blood pressure journey, and I'll see you in another video. Bye.